Boom. What's up, guys? What's up? Hello, everybody. Welcome to our show. What's up, Pops? All the way from Seattle. Yeah, apologize for last week's. We had a problem. We had a glitch with Facebook. We couldn't get on live on Facebook. So appreciate everybody jumping on to YouTube. But we got it fixed. Not sure what the heck was the problem. I just reset the whole streaming software, reinstalled all the channels, and it's working fine tonight. I did the long intro, which is my favorite intro, by the way. But I brought it on because I put that one because it gave me some time to make sure everything worked. So appreciate you guys, you loyal villagers. Appreciate some of the new names I'm seeing popping on tonight. We got a great show. Dr. Jason Keifer. He's a neuropsychiatrist, and he will be joining us tonight, along with Angela Keene, who we had on the show to talk about Dr. Kiefer's treatments for the impacts that Angela was suffering as a result of COVID, of long COVID. So I'm so honored to have Dr. Kiefer on tonight. He'll be joining us in a minute. Charlie is going to be on, so don't go crazy. He will be on. He was heading home. He said he was going to be on about 6:50, so he's 6 minutes late, but that's okay. He'll be on shortly. So, hi, Dr. Kiefer. Ooh, the private chat works. You're coming in, buddy, right now. You're coming in. Boom, and here he is, Dr. Kiefer.
Right.
Hey, mahalo for joining us. I'm going to change this up
Thank
a
you
little
for
bit
having
so we
me.
can really see your face.
Sure.
When we get the others on, we may have to shrink them out. But
Okay.
welcome, my friend. I'm looking forward to tonight. I am looking forward to tonight. I don't know, Angela will be joining us. Charlie, my partner, will be joining us shortly. We did have Angela on the show. I'm sure she told you all about it. We showed
Yeah, she
some
had mentioned that.
pictures, and apparently a lot of people know you. Or have been treated by you. That's in the village. So looking forward to tonight. It's going to be fun. And here comes Angela Keene. Boom.
Oh, there's Angela.
Green screen Keen.
Hey, how are you?
What's happening? What's
Great.
happening? I got my blue and yellow frame on tonight to stand with with Ukraine. I just
Oh,
restreamed the
how
software that I
nice.
use. Yeah, they come up with these templates or overlays. So I figured I'd put it on tonight to show our support for that poor country, what they're going
Wow.
through. I did want to before we get started. I did want to first of all, welcome the villagers. I know last week we had the little glitch and we couldn't. We converted a lot of people to YouTube last week. A lot of people had no choice; they had to jump onto YouTube. Doc, we stream this live on Facebook, YouTube, LinkedIn, and Twitter. So that's going
That's
out right now
awesome.
live on all those platforms. But I did want to say, we had a tragic accident yesterday here on Kauai. Our Civil Air Patrol aircraft went down up in Kokee, killing the two pilots, Jim Dignan and Dave Parker, two seasoned pilots out on a training mission, and something went wrong. So I just wanted to offer our condolences and prayers to the families. I've been a member of CAP, Civil Air Patrol, for a long time, and actually flew with Jim on several missions in the past. And he's an amazing pilot. So something went terribly wrong, and
Mm,
just want to offer our prayers and condolences to the families. Such an unfortunate, devastating accident. So
that's terrible.
yeah, it is.
Yeah.
So anyway, again, welcome to the show, Dr. Kiefer and Angela Keene. We're going to talk a lot about neuropsychiatry, I guess, tonight, and what you're doing to help out patients like Angela. But before we go there, Doc, I kind of, and this is impromptu. This is not, we keep telling our villagers nothing is scripted. It's not censored. This is just live happening before your eyes. But I did want to get your take, as a lot of the discussions in the news right now on
Hmm.
all the media is about the lifting of restrictions. Ironically, our Kauai health, one of our health Department of Health employees, workers, came out and said that the wastewater samples here on Kauai have detected the BA2 variant. It
Hmm.
hasn't shown up in any testing right now because we're really not sequencing all the tests, but the variant is here. It's starting to create a havoc around the world, really. What are your thoughts on this transition that we're at now heading into in a few days. There'll be no restrictions. I just saw no social distancing, no masking, none, zero.
Yeah.
Safe travels will be lifted. Just kind of wanted to get your thoughts on that, if you don't mind, sir.
Yeah. I mean, I think the ideas around lifting and the actual epidemiology and the virology, I'm not an expert in that, but certainly you can anticipate that you would see some degree of spiking. I think for me, as someone who works in emotional health, relational health, psychiatry, neuropsychiatry, you always think about the stress that individuals and groups of people experience during a period of transition, and it's something that we've talked about and begun to plan for here is just getting ready because there's a lot of people who may have adjusted to the new normal of being relatively in smaller groups, working from home, and so the things that we were planning for and thinking about is the extent to which people who are doing reasonably well at home in the current environment and having to go back to work and having to adjust is going to bring additional stress. And there may be people who related to the topic that we're talking about tonight, the COVID impacts on the brain. Some people may not really have a full grasp of how they may be affected or sub-affected until they go back to the work environment and are subjected to sort of the day-by-day pressures and stressors and processing and all the social interactions. And so we're kind of bracing for maybe sort of like people becoming more aware of the extent to which they've been affected uh, by even mild. Like there's lots of studies that are showing you don't have to have severe COVID for it to affect the brain. And so even folks that had a mild illness, they may find that they may have a little more fog than they thought, and they'll notice it when they go back to work.
That's actually what happened to me.
Is that right?
That's what happened to me. So I ended up going back to work and realized that I couldn't function.
Yeah, I think, and welcome, Charlie. Charlie's on. Charlie, Uncle Charlie is on. Charlie, that's Dr. Jason Keifer. Doctor, that's Uncle Charlie. I think a lot of things, while it seems like it's been a long time, COVID is still a relatively new pandemic. It's 2 years old, going into the third year, but we're starting to find out the different impacts it's having on, well, now the brain and the heart and the other organs, obviously the lungs, and a lot of these things have been determined relatively recently because now we've had the time to study patients like Angela and so many others. This long COVID is real. And what are you seeing, Doc, as it relates to the brain? Are you seeing a lot of patients that are coming in with the long COVID?
Yeah, I mean, honestly, I have to come out of the closet in terms of like, when we first started seeing things a few years ago, I wasn't sure. I was very skeptical, as it related to COVID. As a doc, as a scientist, you're always looking for any number of explanations. And then, as we have a way of mapping the activity of the brain networks, and we were beginning to see a significant amount of slowing occurring in all of these people that had, like I said, even sometimes just an exposure and a mild symptom. The obvious ones were the people that had really bad COVID syndromes, and so more and more we've been seeing it, and it's certainly not going away. And of course, we've been tracking this. We've got hundreds and hundreds of brain maps that we were beginning to see this slowing pattern. And of course, more recently, in the last few months, we see out of the UK and Oxford, where they're using a different type of test, but they're identifying and kind of corroborating some of the things that we've been seeing in our tests. And that is, there definitely are some real sort of functional and anatomical changes that we're fairly certain are post-COVID changes. And a lot of it has to do with these sort of frontal areas of the brain that are involved in mental stamina, thinking, planning, judging, and attention. And of course, people present usually with some sort of brain fog is the kind of term most people are describing, just feeling like even simple tasks are hard to do, not having the same clarity of thought and focus. And of course, on the extreme end is, as that type of syndrome goes on and on and on, there's another population of people that really can fall into, really, really bad depression, and other symptoms as well.
We have heard that term being used from day one, COVID brain fog. What exactly is brain fog? I understand confusion and maybe memory loss, but in your practice, what do you consider brain fog? What's the more common symptoms of brain fog?
Well, I think for us it's a familiar term pre-COVID because it's something that many of the people that we've mapped and treated with concussion in the past, people who get sort of frontal injuries, that's usually the area of damage that correlates with people saying, "Yeah, I feel like I'm thinking in a cloud," or I feel like it's taking me too long to think through simple things," or now more recently, brain fog. We're hearing it more and more, and so it was a familiar presentation. That's why a couple of years ago when people were coming in complaining of it, we just kept digging, thinking that it was that these people were concussed. And of course, when we do a history, we find out that none of these people were in accidents, and none of them were taking balls on the head, or they weren't football players necessarily, or rugby players or soccer players. That in fact, the only thing that we had that would related to it time wise was actually a COVID syndrome. And so brain fog, we're pretty sure because we've been mapping it for a while, that it has a lot to do. Think of it like the brain is supposed to be like an orchestra or a symphony. That's supposed to, the whole thing is in a bunch of different regions are supposed to sort of be in rhythm and be on time together, sort of sharing information or playing music. And then when that front area is going significantly slower than the rest, then it really sort of messes up the rhythm, messes up the sound for the brain. It messes up the speed and the clarity of processing. So I think one way to think about brain fog is that it's this important area in the front of the brain, the executive functioning that has to do with attention, concentration, decision making, is just off timing. It's just almost it's in many cases we find that the nerve cells or the neurophysiologic activity in that front region during the day is actually asleep. So it's like walking around half awake in the areas of attention, concentration, and decision making.
That would be me. That's what I was going through. I was basically sleepwalking for the last 2 years.
Wow.
Yeah.
Go ahead, Charlie.
So if one was to not know, unless they share with you they had COVID, is there a distinct pattern between a typical brain deficit that you would see that somebody maybe even if they didn't have any type of brain injury, but neurologically on an X-ray or MRI, whatever you decided to do, it would show up? Would there be a comparison that you can say, this is
You know, the challenge is that, like, for example, the really neat thing about some of the stuff that's coming out of Oxford in the UK the last 2 months, they're using fMRIs. They actually have a subset of patients that they had a pre-infection baseline. So I think that's the hard part when it comes to a lot of those anatomical or fMRI tests, is that in order for you to find those differences that you're asking about, you need to have a baseline study pre-COVID. So I'm sure there's going to be some advancements now that a reputable group out of Oxford, UK, is beginning to publish some of their data on the anatomical and some of the functional changes that they're seeing. I can tell you in our data set, we've been seeing this frontal slowing pattern for well over a year and a half, and it just really turned the corner in the last year. We're fairly clinically certain that it is related to COVID, and it's probably a little too early for me to say what I'm about to say, but I'll just say it, just couching it with saying it's our data set, it's our experience. You won't find anything published on it yet, but we are in probably about 7 to 8 out of 10 cases. There is a certain look to the frontal area of the brain that we're pretty sure it correlates heavily with this post-COVID brain fog picture, especially in kids. So there's just a certain look in the functional activity in terms of how slow it is and the distribution of activity that seems to be almost in again within our clinic and our data set is fairly paradiagnostic of a COVID brain stunning picture or a COVID brain fog slowing picture.
No, the reason I asked it because, in the beginning, dealing with COVID, when it was relatively new on the scene, there was that magical word that no one really understood, which was asymptomatic. So,
Right.
you're walking around, you don't know you had COVID. And then now, you know, as time progresses, right, then you find out you've had something neurologically attributed to COVID. And
Hmm.
yet, if somebody was to go in right now, if they're asymptomatic, they wouldn't know how to approach it because they wouldn't know what to say. So they'll probably go to someone like yourself and says, "Hey, my cognitive skills are somewhat slow. Is it due to Alzheimer? Is it due to onset of dementia? What is it?" And I think everyone is just looking for that correct answer. And I know it's difficult. You said it. You really got to look real hard at this, and it's all a matter of timing, right?
Yeah.
So you
It,
might
it
have.
really is. It really is tying the timeline, like you're saying, and most people, if when most people are fairly in tune with how they were functioning before, and so uh, I think the trick is that I've seen it a number of times, any number of times where people will have their mild to severe COVID syndrome, they'll come out of that for a few weeks, maybe even a few months, feel great, and then 2, 3, 4 months later, after feeling relatively okay, it's almost like this. It's like being in. No offense to those in the Pacific Northwest, but it's like the clouds roll in, like in October, and they don't leave, and they just get stuck there. And I don't know that we have the best explanation as to why that happens. Um, I do know the end result is we just see this incredible neurophysiologic or brain activity slowing in the frontal area, again, the executive functioning, the focus, attention, thinking through problems and planning. So, that can cause people a lot of problems. Even, some of the hardest hit are those that are the people that are doing a lot of the work because they're the thinkers, the planners, the engineers, the investigators, the journalists, people who are really putting a lot of brain power. I think they're the ones that can really notice it and can really be impaired severely by this syndrome.
I was just going to jump in here real quick. That's what happened to me. And I personally think it's because of I mean, for me personally, because of all the steroids that I had, I was feeling amazing post
Mm.
COVID. After my last shot, my dexamethasone shot, I felt good. And then within about 90 days, I started getting depressed and my sleep patterns changed and I couldn't think straight. And I would cry at the drop of a hat if somebody, made a bullying comment on, copy breakers or whatnot. And my lead members actually had to sort of coach me through it. I mean, cognitive therapy didn't help me, medications didn't help me. And that's kind of common for long haulers. We go from doctor to doctor trying to figure what's wrong with us. And I'm just so grateful that I found Dr. Keifer.
I
So,
was glad to see you looking so good.
yeah, yeah, we saw the roller coaster with Angela. We did. We got to ride that roller coaster with her, and it's so nice to see her back in action. So Doc, we have villagers or viewers that are asking, how do you get this diagnosed? Can it be diagnosed by your PCP, or do we need to go see you? How does this work? If we have a bunch of viewers that have gotten COVID and they're feeling exactly what you're describing, and what should they do?
Yeah, I mean, first of all, I'd say I think it's cool that you guys this group is called the Villagers. It's like, as someone who's worked for 20 years with kids and families, it's like it literally takes a village, and even when we're adults, it's good to have a village around looking after one another. Um, the So it's not there's no lab test other than just a good clinical history, and some people have a positive uh, COVID test, others don't. They just know that they had a pretty bad viral illness. Um, and so, people can go to their PCP and get a diagnosis or bring their lab tests and things like that. Or, if you're wanting to look at the brain activity, then, we do have at Brain Health Hawaii, we do have a center in town in Kahala and in Aiea, and we're hoping to create some more places where people can get the we call it a functional brain map or functional brain assessment. And so, at one of our clinics, that can be done. And then, as far as the treatment goes, right now, without a diagnosis of depression and not having responded to the medication for depression, that's really the only way to get the treatment covered. Which many people, like Angela's pretty open about it. That was the process and the journey she went through. Was to actually try the medication, and she was still severely affected, sort of mood-wise and cognitively. And then, based on her symptoms and her presentation, she would meet the criteria for a coverage under depression, regardless of what the cause is.
So we've got from time to time, you'll get someone that says that they believe that their PCP, because maybe this is not their specialty, probably has never seen something like this before. So I'm just wondering, the majority of the people out there, if they run across that problem, what should they do? Because a lot of times it's very hard to convince your PCP, I know something is wrong, and yet based on his practice, he's basically saying, no, I don't see anything wrong. And you're trying to convince him that this is what I'm feeling, this is what I'm going through. And like I said, this can be an asymptomatic person, so yet they have no evidence to say that I did have COVID, but something's definitely there.
Yeah.
Is there a trend amongst the medical community that says, you know what, let's go and try this? Do you know of anything like that?
Not really. I mean, I think most. So first of all, in the PCP's defense, honestly, I think that if I didn't possess this ability to map the brain that we're able to and look at it that way, I think I would have a hard time wrapping it, because you can't how else are we going to quantify it, right? And it's a lot like the concussion treatment space, where for decades we used to sort of blow it off, and it was like, unless you were bloody and completely knocked out and in the ICU, you were fine because you just keep going. But a lot of these people end up being affected for a long time, but you can't really quantify it. So I mean, that all makes sense. I think it's going to take a lot of time, and Angela's been trying to encourage me to sort of get out and raise awareness. We've just been so busy assessing and treating folks that it hasn't occurred to me, like to your point, Uncle Charlie, that maybe we should be sticking our head up and sticking our hand out and letting people know, hey, look, if you are running into trouble and whatever you're trying isn't working, at the very least, try to get like a behavioral health or a psychiatric referral, and you can start there, because at some point, if you're not getting any better with additional steps, there may be a vehicle through a diagnosis of depression to have some treatment covered that has a really good chance of being successful and effective for you.
I was just going to interject really quick. There's a lot of people asking about referrals. So in my understanding, and what I did was I got frustrated and I started making phone calls, and I found Dr. Keifer. I found his clinic. And that's how it happened. And I know that there are people out there that are going from doctor to doctor. And I really don't think you need a referral, do you, Dr. Keifer?
No, you do not.
Okay.
No.
And then
there's some really, I know there's some groups, there's Bradley Cool and their nurse practitioner group. They're aware, and there's some other folks at the Department of Psychiatry and even a Kapilani. So I saw somebody over there, and I think what Angela's saying is true. We all have, when when there's something off, just don't give up. You keep trying, keep looking. Eventually, you'll find someone who will listen, who will kind of maybe not. It's not that your doctor isn't listening, but they'll connect with what you're saying and what you're living, and sort of go around that journey with you to find a solution that's at least going to help some. I think that's important, because again, 2.5 years ago, 2 years ago, I wasn't sure what I was seeing, and I wasn't sure how real it was. But I now more than ever convinced, simply because we've we've actually mapped it, treated it, and seen it on the other side. So we know it's very real.
I want
No.
I wanted to add just a little bit. What makes Dr. Keifer different than other clinics is his personalized treatment. So when clinics do this transcranial magnetic stimulation, it's kind of a one size fits all. But Dr. Keifer is this brainiac who has it all figured out and has this system that he goes through. And he monitors your brain activity every week with an EEG, which is similar to what we do for cardiology with an EKG. EEG is for your brain. He's got this device that's wireless, which is unlike anything I've ever seen in the medical industry, which allows him to follow your brain's mapping and progress weekly. With that map, he takes a look at it and he can see all the different leads going to different parts of your brain and which areas are not active. My worst spot was the frontal lobe, which is executive function, organization, short-term memory, all that kind of stuff. And only now that part of my brain is actually starting to show activity if you compare it to the first scan that I did in October of 2021. So there is a difference in what clinic you go to. And I'm going to brag on him a little bit. The NFL is talking to Dr. Keifer. I know famous people who are flying into the clinic here on Oahu to see him because what he does is so unique and so personalized for each patient. I wouldn't be sitting here today if it wouldn't be for him. I wouldn't be around. Just let me say that. He saved my life. And so it's now become my mission to spread the word about the great work that he does. So if any of you know of anybody that has brain issues, doesn't even have to be long COVID, can be PTSD, OCD, ADHD, autism, you name it. Just ask if you can get checked out and see if you're a candidate to get help. That's what I'm going to say.
One
That was that was going to be my next question, was because 2 years ago we didn't have COVID fog. I mean, that's a new word, right? That word became a word after COVID. Pre-COVID, we had a lot of people could be football players, like you said, soccer players, or that suffered some sort of brain injury, car accidents. That, I guess my question is, those trauma-related injuries, the brain injuries, and which would create the similar impacts as COVID fog. Is it the same thing? Are we talking about the same type of injury to the brain, one being caused by a physical injury, and COVID being caused by a virus? Is it? Are we looking at the same thing?
So again, everything I have to say is, it's in my experience in our data set here. We have. I think I'm kind of losing track. I think we probably have 10 to 20,000 brain maps and looked at hundreds and hundreds of concussions, and I would say that there are some similarities. Obviously, if I get hit in the back of my head, it's not really going to look like a COVID front of the brain slowing. But if you get an injury in the front, there are some similarities. I can tell you, treating it has been different. I think that has a lot to do with your point. What you're saying is the mechanism of injury is that typically, a concussion is an actual acceleration, deceleration, jogging of the brain, or an actual physical blow or some sort of ballistic force, which is like a hit. And so then when you look at that versus what we think are some of the mechanisms of injury within the front of the brain during COVID, I can tell you when we treat it, it's a little bit, the word we use around here is a little bit stickier. Like the concussion will respond faster, in my experience, than the actual COVID brain. And I think that has to do with, the mechanism of injury, whether there may be some oxygen deprivation that's occurring. There may be some, inflammatory reactions from the body. And then in rare cases, there's even some clotting that occurs. These things are occurring. Some of the damage mechanisms that we think are causing the COVID brain injuries. So there are some similarities depending on where the concussion occurs and some of the quote unquote brain fog symptoms. But in terms of treatment, it tends to take a little bit longer for the response that we're used to getting treating COVID brain versus concussion.
So, Doc, let me ask you, getting back to something what you said earlier, and that is patients wanting to go, they know something is wrong, they want to see what's the matter, they believe it's something neurologically that's happening because they've never felt that way before. And I think what Angela had said earlier is sometimes when we go and see someone, if it's um, the individual can be easily frustrated because they want answers, but they may not be able to get answers, right? Because there has to be a period of time that they got to be really studied. And during that time that they get the frustration, that frustration manifests into, outwards type of behavior that maybe can be diagnosed as, hey, you may become dangerous to yourself, right? And I'm thinking about our older personas that might be
Mm.
going through some of this because there's too many times I've worked not worked in it, but had to be called to a behavior unit, security as an example, because somebody's acting out. But I'm just wondering if sometimes people really don't have to be placed there, but they're just experiencing the frustration that we're talking about now, and that is trying to diagnose what the heck is going on with them. What do you think about that?
Yeah,
And,
there's
and
there's no there's no doubt because first they're easily overwhelmed and frustrated because of the actual slowing in the brain that's creating the fog. That'll make you feel. People who experience it are they'll become easily overwhelmed by just sort of simple daily stressors, and a lot of it is because the brain just can't keep up with the information and the sensory inputs. So they're already walking in, not in the best shape, not uh, as equipped as they ordinarily would be to deal with the stress of then going in front of probably a very smart, caring clinician who maybe just hasn't had a chance to sort of uh, see it this way, and then to not necessarily be heard. I mean, understandably, I'm sure I wouldn't be surprised if early on, 2.5 years ago, there were some people that came to my office before I had my head wrapped around this that probably experienced that same frustration with us here. And so understandably, and that can lead to a spiraling effect. Things aren't going well already, and then you're not able to get an answer or you can be heard or a referral somewhere to maybe look for another answer. And understandably, that can really affect people. And my heart goes out to folks like that because it's tough. It's a very, very real thing. And it's one of the reasons why we at Bring Up Hawaii, we just recently brought on another another nurse practitioner so that we could begin to map more folks and see who would qualify, and if those that aren't, we can see if there's other ways that we can help them. So Dr. Tracy Ingram has joined us, and so she's here as well. So if there are people that want to get mapped, we could certainly figure out a way to accommodate them within the context of the schedule, and hopefully get to everybody as quickly as possible and in a reasonable amount of time, because we certainly don't want something bad to happen while people are waiting. And so that's to Angela's point, is like, don't give up looking. There are answers out there. Definitely are out there. And there are good docs out there. And most of the, I know very few bad doctors, really. Most of them are as smart as they can be and caring, and they're all overwhelmed because there are a lot of people going through a lot of complex issues right now. And so, we just want to keep encourage people to keep going, and we'll all get this figured out.
thank you.
So I want to get into the actual the treatment, and I know Angela was on and describing what she was going through. We actually saw some videos, but before we get to that, there's so many different ailments, dementia, Alzheimer's. One of our viewers have asked about multiple sclerosis. Are all of these diseases that affect the brain, is that all mappable in your office? Is that something that your mapping technology can help determine what's going on in the brain?
Well, a thing like MS is a white matter disease, autoimmune. So there are certainly the gold standard diagnosis or diagnostic tools for that are very different in terms of head imaging and clinical history and presenting symptoms. What we're actually looking at, think of it like as a psychiatrist, and looking at the brain, we've always looked at the psychology of it. We've looked at the chemical side, serotonin, norepinephrine, the uh, the neurotransmitter side. But really, what we're looking at is the electrical part of the brain. The brain is an electrochemical organ, just like the heart, right? So bear with me here for a second. So there it was 50, 60, 70 years ago that there were a bunch of people walking around our age that had skipped missing, their heartbeats were off. And then at some point there were some really smart people that figured out a way to use the data from the EKG, the wave readout, to then figure out that maybe there was something going on with the electrical system of the heart. And so now there's a big portion of people that they'll get a mistimed heartbeat, and they can go in and have their electrical system retimed. Now, in my experience, in our data set, we think that's what we're basically measuring the rhythm or the timing of the brain, and looking at areas where the timing is off, and then using these little baby doses of energy, kind of like a really light TENS unit that you would use to activate your muscle, to then just sort of gently wake those areas up, like wake up the areas that are asleep, and then slow down those areas that are overactive, because your brain wants to be more in sort of like a just right, calm, focused processing mode, and a lot of it has to do with all of these regions of the brain being on the same electrical timing or rhythm processing information. So it's all about signal efficiency. So when we look at mapping people, we're looking at those rhythms, and so we see people have sort of ADHD and depression and PTSD and headache and tinnitus and all these different conditions. We certainly do see patterns. We see patterns in the functional brain maps of activity. We see patterns in people who have Parkinson's and dementia, and we can see people on their way to sort of like a pre-dementia as well. Uh, so there's going to be some growing capabilities as our data set keeps getting bigger and bigger. We're able to have some diagnostics as well as some sort of predictive diagnostics and timelines around where people's brains are, and what are the things that are causing some of these issues. A lot of it has to do with like sleep and head trauma, and now we're seeing viral infections, hormone changes, chemotherapy. There may be some folks in the village that have family members, or they themselves have gone through uh, chemotherapy for cancer, and so you'll hear a lot of folks that have been through those chemotherapies, because some of them are neurotoxic. They have brain fog after they've survived, say, breast cancer or lymphoma or GI cancers, and so we're able to see some of these slowing patterns, or mistimed beats, if you will, within the brain, and then basically restore the rhythm in the vast majority of cases.
Well, I guess the question is, if I am having chest pains, if I am having shortness of breath, if I go to the ER, urgent care, or even my primary care physician, and they're showing some sort of heart issue, they're gonna hook me up to an EKG immediately. It's just gonna strap you up and just do the EKG. Uh, I have never had an EEG. Uh, I and I don't know too many people that have. I mean, is that not a readily accessible test where for people that may be suffering from some of the ailments that you discussed? Is that just something that is
Yeah, it's an old test. It's an old test, and the reason why most people haven't had it is because historically, I think Angela alluded to this. Historically, it would take an hour or two, and you get a bunch of gel, like an ultrasound gel almost, around your head, and they put these stickers and wires, and the whole thing would take 1 to 2 hours to get it set up. And what we have now, I should have brought it in here, but I didn't. Is a wireless cap. So a test that would take an hour or two, we can get done in 5 to 10 minutes. So Mel, why don't you come on down? We'll map your brain, and if you allow, we'll share that with the village, and you can kind of see when we see the pattern, I'll likely be able to sort of talk to you about some of the symptoms of functioning that you've been having, and identify patterns and reasons why. But the nice thing is, to your point, a lot of people haven't had it because this wireless cap that we use um, it's still early. It's really being implemented in maybe 10 to 20 clinics worldwide, but it is a portable technology. So I think I'm hoping that's just a matter of time. We talk about it internally, like we hope the day comes in the not too distant future where every primary care doctor will have one of these, because it's like, use a blood pressure cuff to check your blood pressure. Well, we should be taking snapshots of where people's brains are, see where they are, and then track that over time. And I would hope that sometime down the road we'll be there, and that that'd be great for everyone, because then we can catch these things early.
I'll take you up on that, Doc. I will come get scanned or
Yeah,
whatever, mapped. We'll do it live. We'll do it, we'll do it live.
yeah,
I'll
yeah,
come
we
up
can
with
do that.
Uncle Charlie. I three of my siblings. We have four kids in our family. Three of them have been diagnosed with MS. I'm in between diagnoses because one neurologist says he thinks I have it. The other one says he doesn't think I have it. There are some lesions in my brain. They think it's from brain injury from football or whatever. I'd be very interested in getting mapped and just to see what the heck's going on in there. Have you ever done a Portuguese brain before? Because it's quite complicated.
Yeah, we have like three backup systems ready, so in case you go through the first two.
But
Uh,
is it true? Like someone like Mel, if you, the cat, have you had any reading where it shows nothing?
Depends. Depends on how you define nothing.
well,
I'm telling you, my frontal brain was flat
It was
until last
out.
week.
It was out.
And my
I only,
frontal
I only
brain,
told her after she was good. I was like, your front of your brain actually looked demented.
yeah,
And
it,
then of
it
course
was it
yeah.
was
She says, I
it was
know. That's what I was trying to tell everybody. And it really
it
was. The whole
was
thing. The
it
whole
was
thing was
pretty
just
obvious. She started posting things on, and I never said this out publicly, but it is what it is. She was posting stuff on her quarantine page, a quarantine breaker page, that was, this is not the Angela that I met. This is not the same person. And I think Charlie was like, I'm afraid to bring her on the show, Charlie. What the heck? She's like, I'm afraid to bring her back. And and then she shared a very, very personal issue with us, and it was, couldn't help but feel sorry. And all I could think about was how many others out there are suffering from what Angela is suffering from, and are so frustrated because they cannot get the help. And like you said, it's no dig on the doctors. I mean, it's just how do you? It's depression or all of these problems that people cannot really determine. And I'm hoping that at the end we'll be able to share your information so people that have questions can give you a call. But I really want to get into, so you do my map, and then you did
yep.
Angela's map, and then you start the treatment. What is it painful? Do you put probes in the brain?
No, it's
Just spend some
it's
time and share with us the actual treatment.
sure. It's entirely non-invasive. I think that's important. There's no pharmaceutical. It's not invasive. For those of you folks that have had an MRI before, MRIs use 1 to 3 Tesla of energy, so you can kind of feel it and you hear it as loud. We're using zero point 0.1, which is just a fraction. Use it on 4 or 5 year olds, on up to 84-year-olds. Use it on 5, 6-year-old autistics. If you know anything about, young autistic kids, they won't do anything that's uncomfortable or painful, because their bodies are so sensitive to those sorts of things. So basically, people just come, about 30 minutes a day, Monday through Friday, in a comfortable room, and you just kind of sit and relax. And it's passive. You just sit back, relax for 30 minutes, and what we're doing is just locating certain areas of the brain that really just need to be, like I said, retimed. Bring it back online. Take some of the slower areas and bring them back up to speed into a younger frequency. And then some of the other areas that might be overactive and noisy and chattering, causing anxiety and restlessness and racing thoughts at night and can't sit still. and really slowing those down. But I guess Angela could probably speak to it as outside of what I'm going to tell you. But we basically it's so gentle. The standard TMS is using a level of energy that's at or above what's called the motor threshold, which is the level of energy it takes to cause your thumb to twitch. We're about at a third, maybe a half of that. So we're nowhere near this uncomfortable threshold that you might read about. We're so far below, like I said, that even young kids, 4, 5, 6 year olds, basically sit and they like it because it helps to sort of calm and get their focused brain. But about 30 minutes a day, Monday through Friday, for 4 to 8 weeks. In complex cases, sometimes it'll take longer than that.
I've been in treatment since October, and my frontal brain is just now coming into line. So I'm a bit longer than the average patients because I was pretty bad.
I'm so glad you mentioned that because we had an experience as a police officer. Sometimes there's tours conducted at the police department, and they have these special needs children that will come through. And no one ever told us. We always thought that lights and siren is a real cool thing to see, but not with children like that. Because once we hit that siren, boy, that loud stimulus, right?
Mm-hmm.
They went. I mean, that was the biggest mistake. But nobody told us we shouldn't have done it. But I learned real quickly. So the next tour that came from, and this was on Maui, right next to the Cameron Center. They have this special classes there. But I wanted to ask you, in some professions, especially in law enforcement, I think more so now, more than ever, and Mel, you can attest to this because, both Mel and I are both former law enforcement officers ourselves, both police officers. There was always this thing that, we knew sometimes maybe we should go get help, especially when we're experiencing something, but we didn't because if the administration found out what it meant is we possibly lose our jobs, so they're going to take away our weapons. In this day and age, how do you think, or how do you approach it when you see someone for the very first time and you believe that there may be something going on there that needs further treatment? How do you approach it where you sort of protect them, like as saying, "Hey, this is something you may need, and you have nothing to worry about." Because anything that's associated with psychiatry or using like behavioral medicine or something like that, it's like a no-no word in the law enforcement community because it's a sign that you might have your gun taken away from you. How do you approach it?
Yeah, I mean it's definitely historically been challenging. I think we've come a long way. Um, uh, it seems to be less of a barrier, although still present. I can tell you here, bring off Hawaii. I think uh, as we've been assessing more, special operators and SWAT guys and firemen and HPD. That's kind of helped because guys talk to each other, and so being able to actually show them the activity and the brain map, and give them data, give them a picture, give them something they can sink their teeth into. That has really helped. I mean, prior to that, it was much harder. But to be able to give them a tool and something that we can track whether we start with treatment or not, at least gets them in the door and keeps them engaged. Um, because oftentimes, like you said, guys in some of those professions, uh, it takes them to all the way. They tough it out for too long. In fact, I was just working with Hall of Fame football player a few months ago, and he said it. This is a big giant of a guy, and he said, he goes, I realize with this, we no longer need to suffer in silence. It's like there's too many guys have, and we continue to do that. Um, and I would hope that, especially coming out of COVID, I mean, I really do feel like that's one of the silver linings, maybe as a psychiatrist, that I feel like I've seen in the last 2 to 3 years
Yeah.
is I just feel like we're reaching this point in our society where stigma is almost gone. People are really talking about mental health and brain health and emotional well-being and psychological health to a greater extent that I've ever seen in my career. I wasn't sure that we would ever arrive at this place by the time I retired, and so from that standpoint, I'm optimistic that hopefully we can get to more guys, more of these guys that are in the profession sooner rather than later, because they're so important. They're so important in the jobs that they do. They're so important as husbands. They're so important as fathers. And so the more we can get them engaged and keep them in the best shape possible, everybody else does better.
Thank you. Thank you very much.
Dr. Keifer also, I was just going to say real quick, Dr. Keifer also helps a lot of surfers because they get pummeled around in the water a lot and get concussions. Carissa Moore is someone who has been very open about getting tuned up at Brain Health Hawaii. So I'll let you talk a little bit more about that, Dr. Keifer.
Yeah, the extent to which surfers are suffering, any number of subconcussive hits. I mean, obviously that, some of the people that put their heads into reef, those are the obvious, major head injuries like football or worse, or car accidents. But at some point, if you're surfing 3, 4, 5, 6 feet plus Hawaiian, the velocity of the board and then the impact of the fall is kind of like hitting concrete. And, at that point, it doesn't matter. The helmets people think because they have a helmet on, they're not going to get a concussion. Couldn't be more false. The helmet is just there to protect the skull. What you need to realize is that the brain is this sort of maybe a little bit bigger than your fist size tofu sitting in a bowl. And, if you've ever seen tofu in a bowl, you shake it, it twists, it rattles, it shears. And in many ways, that's what happens, even with some of these minor falls, especially in people who are vulnerable. And, that's going to throw the timing of the brain off, and then people will get symptomatic. Their sleep will be off. Their focus won't be as good. And so, again, the mechanism of injury is different than COVID, but, the net result is that the communication and the timing within the brain is off, and then we can just sort of put it right back together again. And the sooner the better. I think there will come a time where we'll be treating people the same day rather than waiting to see if they recover on their own in a month or two.
I'm hopeful. I mean, I'm very hopeful. It's quite interesting news for me, anyway. So you're in Oahu. We have many neighbor island long haul COVID, or even people suffering from the PTSD and all of that. Your treatment is every single day, so it would be very difficult for someone from a neighbor island to get the treatment unless they had a place, could stay up there for the duration of the treatment. Is there like a neighbor island way to do it where
we're working on it? We're working on it. Hopefully in the next 3 to 6 months, we're working on it. If anybody knows any good APRNs on Kauai, that'd be great. I haven't had a chance to connect with anybody there, but I would love to find a way to make it more accessible to folks on the outer island.
What's an APRN?
Advanced Practice RN.
Oh, okay.
Yeah.
There's some right now in the village. I can tell you right.
Is that right?
Yep. There's some in the village right now. I actually see them on the screen. You mentioned, I think you said tinnitus. I think you called it tinnitus.
Yep.
You call it tinnitus or tinnitus. It all depends.
Okay, tinnitus.
I'm sure I'm going to go home. My wife will tell me I said it wrong. So
no, because I've always known it as tinnitus, and then you're like the third person that I heard call it tinnitus. But
it's medical terminology. That's why.
Oh, okay. So is that the proper way to say it? Is it tinnitus?
Honestly, I think I've heard it both ways. I think it's just.
When you went to school, what did they tell you? How did your professor?
I wasn't really paying attention in school. I just figured out later.
So I have tinnitus now. My ear doctor says, "Man, you get tinnitus. My left ear rings." And is that something your map is gonna pick up? And
yeah, I wish you wouldn't have told me. I would have seen it in the map, and then
mine went away. I've had tinnitus post COVID, and it went away for the first time.
Okay. Let's just forget I said that, and we'll see if you can find it.
Somebody named Melissa. So she said something about combat PTSD, and certainly, it's a cause near and dear to our heart. We have really good results with military PTSD, and it's one of these it's one of these instances where the military government insurances are way ahead of the curve, and they take care of these guys. If they get to us, we actually have a paper under review at Nature with the results that we're getting. Uh, and the nice thing is that there's significant changes usually within the first 1 to 3 weeks. So a lot of these soldiers who have been, quite frankly, pretty banged up and in bad shape for a while, and many of them, again, suffering in silence, toughing it out. Um, it's the first time they get a chance to feel some relief from that, and so I saw that pop up on my screen. And sorry to interrupt, but I think
No.
that's just, you think about all the stuff the last 20, 30, 40 years, and then you see some of the newer events that are ongoing, helping these guys and girls that really put it out on the line, and helping them move on in their lives, I think has really been one of the most rewarding things that I've been able to pull off with. I couldn't have done it without Dr. Creekmore, who he himself was a combat veteran and went through treatment. We got him in a much better condition, and now he's able to live out his dream and help his brothers out in IAS and sisters in IAS. So if you know folks that are out there and you can find a way to get them to us, we will take care of them, and we'll put them. We'll find a way to get them in sooner rather than later, because they need it.
Thank you for doing that. I personally know quite a few of our veterans that are suffering and struggling, and there's really not much out there for help. Not much help. Darn. There was something right on the. Oh, I was just going to say that there's been a lot of questions, and I know you can see some of them, but it scrolls so quick. We really would love to have you back at some point, and just to do a Q&A with our viewers, because for us, for an hour show, it's already, we're done, and it's just so interesting. Don't want to interrupt you to pop in a question, so I apologize, viewers. We'll have Dr. Keifer back on to do a Q&A and really focus on some of the specific questions. But there's a lot of great questions. I know you see some of them, and you've answered some of them, so thank you so much.
Couple of things.
I was just going to say, Angela, what are your thoughts?
Okay. If anybody has questions about the treatment itself, there's video of me getting it done, thanks to Hawaii News Now, on my Facebook page, and it's public, so you can go to Angela Keene on Facebook, and you can scroll through my timeline, and you'll see the video. The other thing is, please follow Brain Health Hawaii on Facebook and Instagram. There are messages there. There's a way to reach out there. There's a way to comment there and interact. It's really, really important that you do that so that you get the latest information and news. You can go to Dr. Keifer's website, brainhealthhawaii.com, and look there. There's lots of testimonials. You'll see some very famous faces on there of people that he's helped, including Carissa Moore, myself, not famous though. And the other thing is, you can throw as much medication at a brain issue or brain injury, and it can't wake up an injured sleeping neuron. Okay? That's why long haulers don't get relief from medications. And that's why when I found Dr. Keifer, things started working, because now I'm on one medication versus 6 or 7. And it's so freeing to be able to put those medications aside, to be able to live life every day. You notice that I'm a little more brown. It's because I've actually been in the sun and been outside for the first time in years. So I just want you all to stay connected, follow Dr. Keifer on Facebook and Instagram, and check out his website, and please give them a call if you have concerns. He has such great staff that answers questions, and they're just a great bunch of people.
Awesome. Doc, any closing thoughts for our viewers? I mean, I'll put up the contact information. We really appreciate you joining us tonight.
No, I mean, I just think, first of all, it's such a blessing to be able to live and work here and take care of our community and really focus on that. And Angela brought a point that I usually try to get to, and that is, we just have this amazing staff that I'm so grateful They really carry this place. They care deeply at both locations about everybody we take in and assess, whether we treat or not. And you know, they really do care, and they're professional and caring at the same time. And then, you know, we're just finding a way to get innovative with, you know, sort of safe technology that just works. And I think it gives me hope. It gives me hope for the future, because I think it's just a matter of time before we're able to sort of offer it more broadly, and I would hope over time, you know, coverages will expand and more people will have access, and we're doing our best to expand it so we can make it more affordable as well. But you know, I do think that in a safe, gentle, and effective way, we're just finding ways to optimize people's brains, the communication, the efficiency, the focus. You know, we, like I said, we do it for, you know, post COVID, do it for concussion, sleep problems, you know, early cognitive slowing, depression, anxiety, PTSD, and then you know, we do actually do a lot of performance enhancement, because it's just a safe, gentle form of energy that helps to put the brain in a calm, meditative focus, which is where you want to be, whether you're a student, an executive, or an athlete. And then, you know, and then getting to these long haul COVID folks, and you know, veterans and active duty military is certainly something that we want to remain focused on as well.
Thank you, Doc. Appreciate it. Thank you. Can't wait to get my skull cap put on.
Yeah,
And
when are you coming down? Where do you
uh,
live?
I live on Kauai, man.
Oh, okay.
I live on Kauai, so it's gonna be a little challenge, but I'm gonna make it happen.
Well,
This,
let's find an APRN over there. No,
I'm
let's
gonna
clear
do
it off.
that. That's gonna be my mission. That's gonna be my mission. Charlie,
You said you play football.
yeah, I played a long time ago, you know, but back in the old days, the helmets weren't like the helmets. And I know you said the helmet really doesn't matter, but it was really bad, yeah, back in the day. So yeah, I had a bunch of head
We
injuries
could
in
take
my
care of
life.
that.
So. Yeah, I hope so. Charlie,
Yes, sir. Well, I want to say first of all, thank you so much to our guest tonight. I apologize for coming on a little late, but Judy had called, and I mentioned to Mel, I'll just jump on. But I am so glad I did. I you know, to all of our villagers out there, at one time it was almost taboo to talk about your mental health. But we have gone through so much over the years, and I think it's very important that when you need the help, you cry for the help, you ask for the help. Don't be afraid. Go for it, because you know people have said, "Oh, uncle, you got a calming voice. I want to talk to you." But I'll admit, I will do whatever it takes to help any of you. But there, sometimes you just need someone just with a little bit more or a lot more experience, from all facets to really drive home the point, and that's when Dr. Kiefer comes into play. So, please don't ignore the signs and symptoms that you're faced with. If you feel you have something going on, please go extract whatever you can and do whatever you can to help yourself. Because when you're in good mental health, you and everyone around you are so happy that you're getting better. And I also say congratulations to Angela for getting on the right track and getting back to where she needs to be.
Thank you.
We've seen her for so many years on the news, and we want to see her continue for many more years. To my brother Mel, I don't want you to be afraid because you said it's wireless. I know that if that special cap of his came with a 4-inch needle, you'd probably faint, so you wouldn't even need the cap. You could just dissect you when you're lying on the ground. But you got nothing to worry about, my brother. And I know tomorrow, brother, you are leaving for your procedure on Oahu. So all my prayers, and you get a speedy recovery, okay, bro? And I'll send it right back to you, brother.
right on. Thanks, Charlie. Angela, man, I went right past you. Any closing comments?
Um, not,
I don't know
not
how I missed you.
not that I can think of. If anybody has questions, please reach out to me. I'm happy to put you in touch with Dr. Kiefer's staff. I'm here as a sounding board if you have questions about long COVID, or you don't feel comfortable talking to anybody else. I'm always here. My mission is to get him out in the community so people know that this exists, and don't be afraid to reach out. If you don't ask, the answer is no. So all you got to do is reach out, make a phone call, ask for, an appointment to see if you can get evaluated. And Couple Breakers is still going. We're still there for people if they need it. And we will continue to be there for the community as time goes on, and we work on other things. But for now, we are here, and we will help people, continue to help people.
All right, thanks, Angela, and thanks for making the connection with Dr. Keifer. This is an excellent show. Guys, this is what it does, man. It gives us hope. I know there's a lot of people struggling. A lot of our villagers are struggling. We get the messages, and we know, man. Wish Uncle Charlie and I could do more, but we try to bring out the information, and you guys go after it. You saw the number. I hope you wrote it down. brainhealthhawaii.com. Go check it out. Call and talk to somebody. That's the most important thing right now. You don't got to struggle alone. My son, he's a performance coach in Oregon. He's a personal trainer, and he went through a battle with some mental health issues several months ago. He bounced from doctor to doctor. He tried different treatments. I know he's not watching tonight, but I'm gonna send the link so he can watch this. He's doing extremely well now. He has a therapist, and he's doing extremely well. But you cannot do this alone, and you don't have to do it alone. And Dr. Keifer and his staff is there to help. So I hope everyone will take advantage. As Charlie said, tomorrow fly out to Honolulu. Doc, just hang on. Once we go offline,
You're gonna be here.
Yeah, I'm gonna be there. I'm at Queens though. I don't know if maybe they'll let you come in while I'm under. While they're working on my kidney, you can come and put that skull cap on. And
What time is your surgery?
It's on Wednesday at 9:00.
What time are you flying in tomorrow?
I fly in tomorrow at 5. I leave at 5.
5 a.m., 5 p.m.
No, p.m.
Well, we could find a way to get you mapped, like either in the night or in the evening or early morning before your procedure, and then we'll get one after.
Before and after?
Let's try.
Yeah.
Let's see if we can.
We'll chat. We'll definitely chat.
Okay.
And we'll see what we can do. That'd be so cool.
Mel,
So cool.
the first one you get, Mel, gonna be perfect. Gonna be like this. Then the one after you ready, when you gonna get your surgery, they're gonna map you again, and your brain gonna look like this.
Yeah. He's all making fun of me. He don't even know that I'm. See, Doc, what you
Because I
don't know
love you,
is
brother. I love you.
I'm deadly afraid of needles. I have a phobia of needles, so it's gonna be I'm a wreck. Tomorrow I'll be a wreck. Wednesday morning I'll be a total wreck. But, they're gonna knock me out. It'll be all good.
Yeah, that's what medication is for. That's what medication is for.
Yeah, it'll be fun. It'll be done, and I don't know if we'll see. We'll see. Once we go offline, we'll figure it out.
Okay, sounds good.
All right. To the village. Obviously, we won't have a show on Wednesday night. Oh, if we do, it'll be a funny one. I doubt it, but stay tuned. We'll see. We'll try to be back on Friday. Hopefully, everything goes well. Appreciate you guys' prayers and you guys' kind words. And Doc, again, thank you. Angela, thank you. We will see you guys when we see you all. Thank you. Take care.
Everybody.
God bless. We love you guys.